A very common question that folks ask is how we get away with not doing the drains for top surgery. And so this is in my practice, I haven't used a drain in about 8 years now, but we are doing another technique in order to substitute for the drain. So very simply put, typically when we remove the breast tissue, the old way of doing top surgery, we used to just pull the skin edges together and you'd have a dead space left behind. In general, the body fills that dead space, or whenever you have a dead space in the body, it fills it with fluid, and this fluid is problematic. So very simply, with the drain-free technique, what we're doing is closing down that dead space. So we take a few extra minutes during the surgery and we put a dissolvable stitch on the inside, lots of dissolvable stitches, and we're going to close down that dead space so that we just have to zip the skin itself closed. And in this way, there is no space for the fluid to form. There'll always be a little bit of fluid, there is with every surgery, but we're not going to get a large collection. And therefore we don't need to put the tube in there, which hangs out of the body, and that's your drain. But what we did find when we studied patients we'd done this technique in is that there is an additional benefit. So we found that when we close down this dead space, the patients get a statistically significant decrease in the rate of hematoma. Now, hematoma is bleeding, and it's very problematic with this surgery because if there's enough of it, we have to bring the patient back to the operating room. And depending which study you read, it's quoted to happen at a rate of 3 to 11%. But what we found is when we close down all that dead space on the inside, our hematoma rate drops. I personally think we're getting the same amount of bleeding, but it only has a little space it can bleed into, and then it therefore stops itself and doesn't become significant. Of course, apart from the safety reasons, there's many other reasons. Our patients like the drain-free technique. You don't have to put up with the drains hanging out of you, which often stay around 1, sometimes even 2 weeks, and you don't have to have them pulled out. You're able to shower usually in about 48 hours. So for this reason, and having seen our patients over the years, known our data, I never use drains for double incision top surgery.